Seminario de Estudios de Trabajo y Desarrollo Social.
And the protest, if you look at male nurses, largely involved, and particularly in the new association's leadership, and they even recommended 20% reservation for men in government hospitals. This is a highly feminine job, nursing care. So they're actually, after the protest, seen as a disruptive force. And interestingly, an unanticipated consequence of men's entry into predominantly feminized occupation was effeminization. They were asked to behave like women, which is very hard for men. Also, their recruitment declined during that time significantly, and they started looking for other jobs like medical representatives, so on and so forth. And the protest is continuing in the sense that it's not very active at the moment, but it's an unresolved issue. And the role of the state, if you look at very limited regulation of private healthcare sector, and it's significant challenges to the public healthcare because loss of public trust. These people are spending a lot of money on advertisement and the great doctors they're having, so on and so forth. So this is basically a symptom of a crisis in the healthcare sector. Pandemic moment exposed further the value of care work and the crisis in the healthcare sector. Court, for instance, the court had to intervene with a guideline for the prices of services provided. The last protest is ASHA workers. They are the voluntary care workers. In India, India has the federal system, and India's federal system, health is a state subject. So there are union subjects, state subjects, and there is the concurrent list in which both states and the union are responsible. Health primarily a state subject. So the ASHA's Accredited Social Health Activist program was launched in 2005 as part of the National Health Mission, a centrally sponsored initiative aimed at strengthening primary healthcare services across India. They are scheme-based workers receiving honorarium, not recognized as workers with wages and entitlements. They get the services they provide, each of the services, immunization, antenatal care, there is a specific amount. Additionally, the state government and the union government are giving fixed honorariums. So a new organization came up and they protested in the state capital from February to October 2025, such a long period. They demanded monthly fixed honorarium provided by the state government from $80 currently. So recently they raised to $230. As they belong to, their claim basically was that they belong to a specific category of care work due to the kind of services rendered during the pandemic, unlike similar categories of care workers. And they could build emotional bond with urban middle class and garnered their support for the protest. The popular sentiments was with them, which is not the case when other care workers, similar care workers, protest. And the state, if you look at, organized and kept similar categories of care workers, state-supported self-help collective of women, sanitation workers, Anganwadi, meaning preschool children they take care of, Anganwadi workers. So similar categories of several care workers. Hence, state did not yield to the claims as majority workers were not with the protest, with the union of the ruling government. And there are several similar categories on ground. If you are giving one group, you have to give to everybody. They marginally raised for everybody after the protest. I would argue that ineffective mobilization strategy of protesters because you cannot win a protest with the popular support of the middle class. Rather, broad-based solidarity building of care workers is needed